Agahan. Going and up.
Oh, why are we hearing people? We should not be hearing people. Sorry. Okay. All right. So let's get started. Welcome everybody to another webinar with Palcus. My name is Angela Simos, and I'm here with Denise Borges, my co-host. Hi, Denise.
Hello, most awesome chair and co-moderator, universe beyond and from the beginning of time, pre-Adam and Eve.
Mm-hmm. So those of you who have been joining us over and over again, you will understand the joke there. So thank you, my most awesome co-host. We are here today with Dr. Joe Amaral to talk about COVID-19 and the Portuguese community specifically. And so before I hand it over to him, just one quick housekeeping item that if you are following us on Facebook Live, awesome, thank you for joining us. You can type your questions down into the comments. But if you are on the Zoom link, please submit your questions to the chat module, and we will read out the questions to Dr. Amaral towards the end of the presentation. And with that, I'm going to hand over controls to Dr. Amaral so that he can
Thank you so much, Dr. Amaral, for giving us this this unique presentation. We are all looking forward to it. I know Angela and I have talked about it, and most generous with your time, and we appreciate that very much. I know the community appreciates it.
Yeah, very much.
Muito prazer. I'm very happy and honored to be able to do this, and I should be able to share my screen now.
Yep.
And I will share my screen. You don't need to see my calendar, but hopefully everybody can now see my title slide, Ponderings During a Pandemic. Is that correct?
Yep. And you have quite the CV. So if you could just give our viewers a little bit of your background and expertise, that would be helpful as well.
Sure. So for those of you that don't know me, I'm a surgeon by training and education. I lived and practiced in Rhode Island. I developed a series of technologies that are used in surgery today. I did research. I became a professor of surgery at Brown University, and then chairman of the Department of Surgery for a year and a half, and then subsequently became CEO of Rhode Island Hospital, Hasbro Children's Hospital for 7 years. Left there and went to work at Johnson & Johnson doing innovation, vice president of innovation for Ethicon, which is their surgical division. Then finally got to the age where I could retire to find out that I don't know how to retire. And currently I spend part of my time working with different startup companies, which is something that I really enjoy. But 50% of my time is working in venture capital as chief medical and scientific officer for venture investors, which is in the Midwest. On this slide, you see my email address, jfamaral@mac.com, and I bring that to folks' attention. Ponderings During a Pandemic is something I started right at the beginning of March. And every day I write an essay. I used to call them posts, but they're much longer than posts. They're essays, and they're all related to the COVID-19 pandemic. They cover topics that are on people's minds, on my mind. It might be about what's bothering me or something I read. But in essence, the point of them is to try to get rid of a lot of the confusion that comes to us through the media and through our conversations with colleagues and friends, try to give some guidelines on how we can function during this and bring a good dose of history to what's going on so that we can perhaps better understand it. My general rule is no politics. So most of them I never talk about politics. I will say, though, that as time goes on, it's hard to separate politics from the pandemic. Yet I really try to be quite neutral. So if you're interested in receiving those, you can either go to Facebook or you can email me. I have a mailing list that I mail them to every day. And right now, for example, is a series on education and opening schools. So my roadmap for today is actually to talk about what's a pandemic, what is COVID-19, and what's a pandemic? How does that look historically versus what's happened? What's going to happen as we continue to go through this? What can we do every day to make ourselves safe, yet be able to live a more normal life? And hopefully then I want to talk specifically about Portugal with a focus on travel, and schools and opening schools, and not in detail, but just a quick overview for folks. But I want to make sure I leave time for questions. So to start with, this is SARS-CoV-2. It's a virus, and it has these little bumps and these bigger bumps that you all hear about. And there's a lot of confusion as to what these things are. So just for clarification, SARS-CoV-2 is the name of the virus. COVID-19 is the disease. The reason that these are not called by names of places as they were in the past is because when you name something after a location or an animal or a person, it brings a lot of negative things. For example, people stopped eating pig during the swine flu. It had nothing to do with it. And so in 2015, there was a convention agreed to stop naming viruses after people, places, or things. So this is SARS-CoV-2. It's not the China virus. It's not the Wuhan virus. It's not any virus. It's SARS-CoV-2. And the virus causes the disease COVID-19. A pandemic is when an infectious disease, or it can be a non-infectious disease, but it's when something just goes all over the world. And generally it occurs simultaneously, all at the same time. And in order to be a pandemic, it should be novel. It should be something that people have never seen before. So SARS-CoV-2 is novel. The virus had never existed before, never infected man at least. And as you see on this map, what's in green are countries that have had SARS-CoV-2 or COVID-19. What's remarkable about it is when you look on the right, those are the countries that have not reported any cases. The second thing that's remarkable is it seems the world can't agree on how many countries there are. In the United States, we say there's 195. The United Nations says there's 213. I don't know how many there are. What I do know is that most of those places on the right, except for 2 or 3, I have no idea where they are. Essentially, this is everywhere in the world. And today by now there are 19 million cases and about 720,000 deaths. Now, if I break this down into the United States, I'd like to compare the United States to Portugal. So the United States, as everybody knows, has experienced the most cases of any place in the world and the most deaths. On a case per million basis, we have 15,000 in cases per million people that are diagnosed with the test, and about 488 deaths per million people. Portugal, on the other hand, a much smaller country, has had many less deaths, 51,000. I'm sorry, cases, 51,000, many less deaths, 1,700. But on a case per million, it's 3 times less. It's done really well. It's done as well as anyone in Europe has done. And it also has a very low death rate compared to the United States and many countries in Europe. So we should really be proud of what Portugal has been able to accomplish, a country with not a lot of resources. And what I'd like to say is, we hear all the time in the United States how many tests we do. Well, Portugal has done essentially the same number. United States is tested at 188,000 tests per million as of today. Portugal is at 165,000 per million. So Portugal has done an incredible job of pulling together as a country to prevent the spread of the pandemic within that country. And when you look at the graphs on the right, what you see is kind of startling to me. On the top is Portugal. Portugal had their deaths. Now, this is 30 deaths per day, as opposed to the United States, which was 2,000 at its peak. But unlike the United States, which started to come down and now has increased and is running at about 1,200 deaths per day, Portugal has essentially continued to drop and drop. And I find One thing that I think is wrong is that the UK has barred travel between Portugal and England for reasons that aren't clear to me. Portugal is way better than the UK is in terms of cases or deaths or control. So Portugal has done really well. And one of the highlights to this is that early in the pandemic, all the elected officials, no matter what party they were from, came together and they said, we're not going to put politics in the way of dealing with this. We're just going to have one uniform message. And that is the message that's gone out to the people. Doesn't mean there aren't protests, doesn't mean there isn't dissension at times, but there's been a unified response in Portugal, unlike what we've seen in the United States. Now, many people look at this disease and say, well, it's just the flu. And you basically can break the world into two groups of people in America. One that say, well, this is terrible, it's awful, I'm really scared, I'm not going out of my house. And there's another group of people that say, it's just the flu. Well, just the flu is the common statement that was made in 1918, 1919. So I thought it'd be useful to look at three episodes here for comparison. If we look at the 1918, 1919 influenza, some people call it the Great Influenza. Others would say the Spanish flu. Ironically, the reason it's called the Spanish flu is Spain wasn't in the war in World War I, and they were reporting their deaths. It didn't start there. It actually started in Kansas in the United States. It's estimated that 675,000 people died. If we were to translate that on a population basis to today, the 1918 influenza would have killed 2 million people. Regular influenza that we get every year leads to about, on average, 35,000 deaths. And that's the average for the last 10 years. The highest has been approximately 60,000 in 2018.
And this is worldwide?
No, this is just in the United States.
Just in the United States, okay.
I'm focused on the United States here.
If you look at, sorry. Sorry.
Yeah, if you look at influenza globally, it was like 20 million. Most of the deaths actually were in India. Now, COVID-19 to date has it's now over 162,000. I looked just before we started this. So 162,000 people have died. So if we're to compare this to influenza, it's clearly not influenza. I mean, we're at 5 times the number of people dying to date from this compared to influenza. So we really should stop saying it's influenza. However, if you look at COVID-19 versus the Great Influenza of 1918, 1919, you could say, wow, look at 2 million died versus 161. Now, the 161 is actual deaths. It's not estimated deaths. That number is probably closer to 230 to 250,000. Estimated deaths is you don't capture all cases. People die and they never get tested. And so only at the end, you compare the number of deaths in each month to the past 3 months and figure out the excess deaths. Whatever you use, let's just say this is 200,000 deaths right now versus 2 million. So this looks like it's 10 times worse. However, during the influenza of 1918-19, there were 3 things that were happening that aren't happening today. The first is the world was at war, and the America had ramped up in 1917, 1918 to go to World War I. And the camps for the soldiers were chock-a-block full. They would make a camp to hold 40,000 soldiers, and it was holding 60 to 70,000 soldiers. And that crowding, which is where influenza exploded, was not present today. The second is that hospitals didn't have single bed rooms or double bed rooms. Hospitals were composed of 20 beds or more in a ward. When you got sick, you went to a hospital, you're just spreading it around. But more importantly, there weren't doctors and nurses in the United States. All the well-trained doctors and nurses had been shipped overseas for the war. So there was a tremendous shortage of doctors and nurses. Okay, but still, even all that, it's still 2 million versus 200,000. However, today we have oxygen, ventilators, intensive.
Estimated 2 million.
Huh?
Yeah, I don't know why someone has audio and they shouldn't. So just go ahead, ignore that.
So the 2 million So the 2 million is if you correct the 675,000 for the population 1918 to today, there's 3 times as many people. So the 675,000 deaths, if it happened today, would be 2 million deaths if everything was the same. So you have to translate for the population. So today there's 161,000, let's say 200,000 deaths from COVID-19. But today we have oxygen, ventilators, intensive care units, antibiotics, dialysis machines, transfusions, advanced tests like CAT scans, MRIs, and personal protective equipment. None of that existed in 1918. Most people in 1918 died of pneumonia. They didn't die from influenza. And today, antibiotics treat 80% of pneumonia. So one can easily believe that this number would have been probably closer to 70 to 80% less if what happened in 1918 happened today. So COVID-19 is just as bad as the influenza of 1918. While the actual number of people might not have died, if we had all the advanced technologies that we have today, that number wouldn't have died either. And if we hadn't had overcrowding, where most of the deaths occurred. When we look also at the flu rates by ages, there's a few things I want to point out. This is regular flu on the left. In general, regular flu, the death rate is about 0.01% through most age groups. And in the elderly, it has a higher mortality, somewhere around 0.83%. It is higher, probably around 3 or 4% in those who are over 75. When we look at COVID, we see a very different pattern. I want you to focus that there is a 1.9% death rate in children between 0 and 4. So it's not a benign disease. But overall, in younger people, it is low, but still 10 times greater than influenza. When we look at the 1918 influenza, we see there was a high death rate in very young children and in the very old, very similar to these diseases. What's different is that this disease affected people in their 20s to 30s, and a lot of that was the soldiers. And there's also immunity, because what happened is that this middle group of age group were the group that were most infected, some of it because they were soldiers, but also because they probably didn't have immunity. And the elderly, even though they were more likely to die if they got sick, didn't get sick. So 3 very different patterns of disease that you see here. Well, we have death and we have illness and we have a lot of hospitalization, but we also have an economic mess. So pandemics aren't just about the impacts on healthcare, they're also the impacts on the economy. Fed chairman at the end of May said, we're experiencing a whole new level of uncertainty, and there's a tremendous economic downturn. The Wall Street Journal in May reported a 13.3% unemployment rate. In the last 18 weeks, we've added over 1 million people to the unemployment rolls. Currently, there's approximately 31 million unemployed Americans, half of whom will be losing their employer insurance and without health care. Portugal hasn't fared much better. In fact, Portugal has done worse probably than most countries in Europe. The average for Europe, I think, is around 10.4%. Portugal is at 14.1%. The best response has been in Norway, where it was only 8.9%. So the economy of countries all over the world is struggling and is slumping. It's not any different in the United States. So every day during this pandemic, we hear all the negative things. Never in our history. We're living in unprecedented times. Life will never be the same. And in fact, the survey done at the end of May, only 9.4% of people thought that that things will go back to normal. I have a different view, which is that if you look at all these pandemics, they've all been just as bad, and things typically go back to normal. It's just a matter of when, not if, and only a few things will change. So we all have to make decisions in our life, whether it's to go to the grocery store or whether to buy a house or get a car. There's a lot of complex things that we do. When we make decisions, we look at the facts. Reality is there's no facts about the future. we only can look at history and what has happened historically. We look to our experiences, but we've never had experiences with the pandemic. HIV was really the last big pandemic we had. But it was a completely different type of pandemic. It wasn't a respiratory pandemic. And then we look at the circumstances, what's going on in the world, and how does that reflect? So in general, millions of people die from a pandemic, and we'll be there, unfortunately, pretty soon. That number will be over 700,000, well over a million, rather. But, they might 36 million for HIV, but it went over a 7-year period. In general, there are 1 to 2 to 3 million people are dying in these pandemics, 20 to 50 million estimated for the Spanish flu. But prior to 1958, all these pandemics occurred with very little medical care. In fact, bacteria were only discovered in 1880s. So you can imagine that these are all happening with no medical knowledge. So pandemics are emotional, and I'd like to take you through. And while we might think that this is horrible and that we can't believe that this is happening the way it is and that people are doing the things they're doing and saying what they're saying, they all are the same. The way all pandemics start is that few, if anybody, can predict the catastrophe. Partly it's because they don't know, but partly because he who cries wolf many times gets ignored. And, we had SARS and it didn't come here, and we had Ebola and it didn't really come here. And so people think, well, it's not going to come here. In addition to that, we have a certain degree of, hey, this is America, this is Portugal, we'll survive, this will be great, it's afraid of us. So they get started. Governments and individuals, for the same reasons, tend to initially deny it's going to happen. Then, as they start to figure out, we need to do something, they tend to start too late. If you're going to stop a pandemic, you have to stop it at the very first person who gets it and quarantine them. Once that person spreads it to somebody else who spreads it, it just starts to get rapidly out of control. If you look at Ebola, the reason it's controllable so often is it's such a deadly disease and so obvious that and doesn't have a pre-symptomatic period. People get away and it will essentially kill itself. So the response is always too late, and then we have trouble counting the dead. Initially, we have trouble counting the dead because nobody wants to believe they died from the infection. Then we have trouble counting the dead because so many are dying, we can't keep track. We saw a little bit of that in New York. People dying at home, we don't know what they're dying from. People start to get nervous. It starts to become a crisis. We're not feeling good. And this is true in influenza. It's true in TB. It's just true in every pandemic. And then we start saying it's incompetence. We should have started earlier. We should have done tests. We should have done this. We should have done that. Nobody knows what they're doing. And people get out of the cities. They get out of the cities because they realize the further away they are from people, no matter what kind of disease it is, the more likely they are to do well. And we've seen that happen in this pandemic, but it happened in TB, in the plague, in yellow fever. People escape from the city to the country. So the cities become ghost towns. Not only do things close down, there's nobody there. And who's left? The vulnerable populations, those who aren't affluent, those who can't escape, those who are dependent on to bring the food, to bring the groceries, the gig workers that we have today. And those are the ones that end up getting sick because they're the ones that are out there fighting the virus by themselves. Friendships and families start to suffer, and in some cases, they just go away. Brothers don't even want to talk to brothers. And in chickenpox, they wouldn't even name children that were born for fear that the child would die. Not chickenpox, smallpox. People act poorly, especially people in leadership. They do things you just wouldn't imagine. And that could be a church leader, it could be a government leader, it could be a business leader. It's a self-preservation mode. Leadership is hard to find. Nobody can agree on anything. measures start to get more and more drastic as people start to throw the kitchen sink at everything. Unemployment starts to soar. People start to get hungry. Then we get into finger blaming. We blame countries. We close borders. We blame people. We blame everything. And people then are just afraid to leave their house and they stay inside. This is, again, yellow fever, TB, influenza, doesn't matter. They're all the same. We then enter a period of nationalism and protectionism. We shut our borders. We do everything we can for our country. We forsake everyone else because we need to survive. And people fear the sick. You don't want to go near anybody that's sick. Oh, they coughed, or whatever it is. There's this isolation that occurs. Everybody tries every kind of medicine they could think of, and they all fail. They do all sorts of theories, which also fail. And the media starts to conflate information. There's a lot of information. It's hard to process. Science is not written for the lay people. Science is written for scientists. It's really hard for the average intelligent person to read a scientific paper and understand it. And so things get kind of twisted. Misinformation starts to spread. We have all this doubt. The government's out to get us. Conspiracy theories start. In the cholera epidemics in Italy, people were told not to eat rotten vegetables and drink the water. And they thought because the people would come to the lower city and wouldn't get sick when they came, they thought that the government was trying to get rid of them. So they would go protest and eat raw vegetables and drink the water in the city streets, get cholera and die. People get confused. There's so much information. It's made so complicated. People are arguing things that are not really relevant. And then all of a sudden, it just feels like Armageddon. The world is falling apart. Everything is going wrong. Safety then starts to be fought by economics and religion. It's the importance of religion is more important than safety. The importance of economics is more important than safety. And those who are in power start to fight each other so that the political officials and the religious leaders and the economic leaders are all fighting because they're all trying to maintain power in a chaotic environment. People continue to struggle to eat. They continue to point more and more fingers at authority. Businesses have to open, but tensions are really high. A spark sets off violence, protests, riots. In the United States, we have Black Lives Matter. In Germany, we protest because the restrictions are too great. In Israel, we have protests because the restrictions aren't great enough. In Russia, we have protests because they're not doing enough to protect other countries. So it's just a matter of people are despondent and they all give up. It doesn't matter anymore. And then pandemic ends. Nobody knows why. And they're all the same. So it's basically the concept of predictable irrationality. And there's nothing that's happening that one wouldn't predict would happen and that we couldn't have stopped had we just taken a moment to kind of think about it. But all these things come out. So they change society, but they change society minimally. There's usually a reset of politics and power, often associated with a war. Life expectancies increase because usually it's the older people that die, and therefore wealth shifts. Healthcare might have one or two things. The biggest, most notable change was socialized medicine in Europe. It's not clear whether it was from influenza or from the war, but we might get an ICU, we might get a new treatment. But in general, there's not much that happens. The one area that you can always look to that becomes rich and great, it happened with the plague in Florence, it happened with TB, is literature and art. It's amazing to look at how people take the experiences that went on and reflect it in the art. There are things that were important prior to the pandemic. They're going on now. You know, Medicare for all or healthcare. The polarization of society was present. Geopolitical tensions, elections. Initially, they all quieted down, but as this has gone on, they've all come back. including an increase in problems of mental health. The only thing that hasn't emerged, unfortunately, is an exploding economic growth. Privacy issues are an issue. We don't have contact tracing apps in the United States. We're one of the few developed countries that don't, where people monitor so that they can easily control the spread. That's a privacy issue. And there are things today, though, that should give us optimism. We live in a world which has an inordinate amount of speed in its communication. We have amazing medical technologies, molecular medicine. We have powerful computers. We can use machine learning and artificial intelligence to our advantage. We innovate at an accelerated pace. No one would have thought you'd have a vaccine in phase 3 trials in, less than 5 months. We understand the human genome. We have social media. And I will say that the media, social media, while initially I complained, I now think, oh my God, how lucky are we to have that? Imagine if you were dealing with this and all you'd have is the local newspaper that comes out once a day if you're lucky, and a radio. Because there was no television in the 1918 pandemic. It was a radio, and it was censored because nobody wanted to do anything against the war. So we end up in a world where everybody says we're going to redesign everything. I get so tired of listening to these words. We need to reprioritize, restart, retool, rebuild. Really, here's what we do. It's all unknown, it's all uncertain, and it's all predictable. And if you take that viewpoint and stop worrying about what it's going to be and just figure out that tomorrow might be different than today, stress is a lot less. It's just the way it's going to be. In fact, I love this opinion piece from the New York Times. No one knows what's going to happen. And for me, is stop worrying and try to figure out what you can do tomorrow. So what can we do? We need to make it simple. And so just to start, you can go on debates for the next 3 days. There's some really simple concepts. If we all just take these, I think we can figure out what to do. This is a respiratory transmitted virus. That means when we cough, sneeze, talk, spit, the virus comes out if we have it. So you need to not be exposed to that. That will stop you from getting it. There are ways to do that. The second is it's airborne. Sometimes I wonder to myself, how can we get into such a discussion about whether it's airborne or not? Well, it actually has to do with the particle size. Virus does not live. A virus will not survive, will not be able to infect by itself. It dries out. So viruses are usually surrounded by water. And when you cough, sneeze, or talk, the droplets that come out are fairly large, but there's little ones also. And it creates sort of a mist or an aerosol. And that aerosol is lighter and it can remain in the air. What being airborne means is if you're in a confined space with poor ventilation, it's circulating around. Incidentally, that's true for influenza as well. It's highly contagious. SARS-CoV-2 is 100 times more contagious than SARS. It's also about 100% less lethal than SARS, or not 100, but 20%, 20 times less lethal. It's more contagious than influenza. So you don't want to get near it, is the bottom line. It generally is believed that 15 minutes in an indoor environment is enough time, if the virus is in the environmental air, that you will get enough of a dose, which is generally about 1 million viral particles. These are estimates. You can't do an experiment to figure this out because you'd have to infect humans, and all animals respond differently when you give them, when you try to do an experiment. Tremendous confusion about asymptomatic and pre-symptomatic. Asymptomatic people are people who have the virus but have no symptoms and will never develop any symptoms. Pre-symptomatic people are people who have no symptoms when you encounter them, but will develop symptoms later. Essentially what that means is Everybody can have the virus, no matter how they look or feel, because you don't know if they're asymptomatic and can spread the virus. You don't know if they're pre-symptomatic and are going to develop the virus. Being fine does not mean you don't have the virus. Most cases of large spread of the virus occur in what are called super spreader events. One person spreads the virus to 50 or 100 people. Those events almost always happen in a confined space in an indoor facility. It can be a church, it can be a manufacturing plant, it can be a school, I guess. I haven't seen them in schools, but it's in an indoor facility. And so these super spreader events account for about 80% of the transmission of cases, not individual transmission going on. So bottom line is, it's in the air, and you need to assume that everybody has the virus. So after listening to all this, I made this little thing, spaces. Just think spaces. You need to keep space between you and the virus. S, soap your hands. Washing your hands without soap is not effective. You need to use soap because the soap breaks the outer layer of the virus, and then the virus can't infect. Soap your hands for 15 minutes. P, physical distance 6 feet. I like to think of a skunk. You should get close to another person, as close as you would get to a skunk if you were afraid that they were going to spray you. You probably won't get that close. So the minimum distance you want to keep from people is 6 feet. This does not mean your spouse or somebody that you live with in the house all the time. It's when you're out and encounter people that could be your friends or relatives that you haven't been with, because you don't know what they're doing. Avoid the indoors and avoid crowds. Avoiding the indoors. If you want to have 2 friends over, you can do it outside. If you're outside with fresh air flowing around, you may or may not even need a mask. Depends on how far away you stay from somebody. But being outside is okay. If you're going indoors, always beware. Like, I always get nervous when I go into a little convenience store. It's a small enclosed space with no ventilation. And being that I currently live in Florida, where nobody wore masks for forever, you have no idea what's floating around in that air. Cover your face. Please wear a face mask. It is not only for you, it's for everybody else. And I'll talk about them more in a minute. Enjoy the outdoors. Go outside, walk around, talk to your friends. You just don't need to get very close to them in order to enjoy them. And stay in your bubble. Define a group of people, about 10 or less, that follow the same rules, that are as vigilant as you, that care as much. And think about it like a marriage and just stay true to your bubble. If you do that, you'll be fine. It's going to be fine. Doing these spaces things is all you really need as your general rules, spaces. There are a lot of myths about face masks. 1, oxygen levels decrease and CO2 can be rebreathed. Wrong, not true. People have actually worn 6 masks all day to prove that. I'm a surgeon. I wore a mask all day. Doesn't happen. There's a porosity to it that just prevents it from happening. Second, you don't need a mask if you feel fine. Wrong. Just because you feel fine doesn't mean you do not have the virus. Representative Gomert from Texas now knows that. If you physically distance, you don't need a mask. Wrong. You need a mask whenever you're out in public and encountering people, whether you're 5 or 6 feet away from them, because it's in the air. It's not just the person, especially if you go indoors. If you're outside and there's nobody around you for 10, 20 feet, you're fine without a mask in that situation. A mask won't stop you from getting sick. A mask will stop you from getting sick. The data now is 65% reduction. If you're wearing a mask and the other person's wearing a mask, it's even less than that, because you both have a 65% chance of reduction. So it's closer to 80% or 90%. You don't have to wear a mask if you have a medical condition. Wrong. if you have a medical condition, that's all the more reason to wear a mask, unless the mask interferes in your medical condition. If you have bad COPD and you can't breathe enough oxygen, well, you shouldn't wear a mask. But you should be the last person to go out or to let people in your house, because you're at the highest risk of death if you get the virus, because you don't have a lot of lung capacity. There's a little twisted logic there. And the other is that's enough to just wear your mask and not physically distance. That also is wrong. You need to do all the spaces measures together. It's combined that they all work. So Portugal has been at the leading edge in many ways, and I wanted to introduce the topic of Portugal just to talk a little bit about travel by pointing out that a virologist, Tedros from the Institute of Molecular Medicine in Lisbon, actually has developed a mask which inactivates the virus, and it actually works. It was tested at the Pasteur Institute. And remarkably, even he said, but you need more than the mask. You still need to physically distance. You still need to avoid crowds. You still need to do all these things. I don't know if this is commercially available yet, but it is now available in Portugal, France, and will hopefully be available to us as well. So Portugal remains under a state of alert. And what that means is that if you have COVID-19 or think you do, like you went and get a test, you need to be under mandatory confinement either for 10 days, 14 days, till you no longer have a fever or your test came back negative. Events in all of Portugal are prohibited to have more than 20 people, except in Lisbon, where the number is capped at 10. Restaurants can stay open until 1 o'clock, although in Lisbon they close earlier, I believe. You cannot have alcohol in public spaces except in restaurants, cafes, and bars. You have to socially distance. You must wear masks when in public and in public transportation, in not public walking on the street, but public transportation in any building. And you are fined 100 to 500 euros as an individual, or 1,000 to 5,000 euros. So I would think that these things have helped them keep their case rates and their transmission rates low. Now, if you hold a Portuguese passport and you want to go to Portugal, what I'm going to tell you is I can't figure that one out. My belief is you can't. However, my recommendation is you call the Portuguese consul and see, because the rules right now are that only essential travel is allowed to Portugal from the United States. Essential travel is defined, you have your spouse is there, you have a medical emergency there, or you have some sort of business there. And if you do go, you have to have a negative test done 72 hours beforehand and take with you in your hand that proof. Americans are not allowed to enter for tourism. Portuguese nationals can, and this is why I'm a little confused, because if you own both passports, I don't know what that means. So I can't answer that question. There is no mandatory quarantine on arrival, which is a little bit unusual from other countries. But there is a mandatory mask law on airplanes that go to Portugal, and they will do temperature checks and a health screen on arrival. So the last thing to talk about here is about school opening. And I probably would be able to spend a full hour on this. I did want to touch on it because it's an important aspect. Actually, the next 4 essays I'm writing are related to this. Fundamentally, this comes down to 4 issues with opening schools. The first is, what is the risk to children, and how often do children transmit the disease, and how sick do they get? What is the transmission? The second point is, what are the local conditions in the community in which that school is in? The third is, how have we done with camps and schools that have opened? And the third is, what are the measures? So I certainly can't cover all these topics. What I do want to say is that when you hear people arguing one side or the other, the reality is They're just arguing. Data that's used from Germany or Denmark or South Korea is not transferable to the United States. Those countries controlled the spread of the disease. They all had reproductive transmission rates, which I'll talk about in a minute, less than 1. They kept their cases low and flat. They all opened only when the time was appropriate, and up until recently have been low and not rising. That's not happened in the United States. So you can't compare those countries to the United States. Second, the data that's used is data that comes from March and April. That's not what's happening today. We know the virus has mutated and that it appears to be more infective today than it was in early March or April. So using data and statistics from March or from China doesn't help me understand what's going on. And lastly, and perhaps most importantly, is typically schools are the first thing you close in a pandemic or an epidemic, because children are more social and more interactive with adults than other adults. And they are typically the most important source of spread of a disease. So you close the schools to stop the spread. And we closed the schools. So during March, April, May, and perhaps into June, children have been mostly at home. They have not been interacting with other children and with other adults. So telling me what happened in March with kids doesn't really tell me what's going to happen today. So we need to be realistic and honest and say, we really don't know what's going to happen. There are wonderful stories. Schools opened in Denmark. Incidentally, those schools are mostly held outside. All class sizes are less than 15. The classes are staggered. They did it in Germany. In Germany, they go to school every other day for a half a day. It's not business as normal in any of these countries. But there are negative experiences in Sweden, negative experiences in Germany. And the worst example is in Israel, where after 1,335 students got sick and 691 in various schools, they ended up closing 125 schools, and now is thought to have been one of the major contributors to why they just surpassed the United States in cases per million people. So despite that negative approach, I do think there are many places that schools can be opened in the United States in the next month. I just don't think they can be opened everywhere. And I think it's foolhardy to think that every school is going to open. Within that process, a safe opening, there's clearly things that need to happen. Class sizes need to be reduced. Physical distancing needs to be enforced. Mandatory masks should be required other than when students are sitting at their desk or children are less than 5. What you do for children that are 18 or 17 is different than what you need to do for children that are 3. The spreading ability, the transmission ability of a child ages 10 to 18 is the same as an adult. It's not clear yet what it is for those under 10, but those under 10 who get infected actually carry more virus than those over 10. You have to know what the community spread is. You have to have a strong, robust contact tracing mechanism in place to make sure that if somebody gets it, you can stop it from spreading further. And you have to be able to do tests really fast and get the results, because telling a kid to quarantine for 14 days isn't going to help his education. And unfortunately, we're not doing so great on the bottom 3, and that's going to be variable from community to community. And there are communities that are doing an amazing job when I've read what they're doing or friends and colleagues have told me. Most Portuguese people live in these 8 states in America, California, Massachusetts. So I took the important elements for determining what's going on in the state. And one is the reproductive transmission rate. That's how quickly the virus is transmitting in the community. If it's less than 1, you do not have an epidemic possible. If it's greater than 1, it is possible. In other words, what that number means is 1.5 means one person spreads it to 1.05 people. Whoops, I don't know what just happened. So the other is how many tests you're doing. The national average for testing is 2.1 per 1,000. The more tests you do, the more you're going to uncover, which will help to reduce the spread. But also, it's important to know what percentage of those tests are positive. The recommendation of the CDC and most epidemiologists is that in order to safely open a school, you need to have 5% of your tests or less positive for 2 consecutive weeks. So in California, which we've heard a lot of with their negative increases, California looks like it's in a good path to open soon. They're trending down in cases. Their tests are very high. They have a low transmission rate, indicating that they're getting it under control. They're at 5.5, but I think they'll be okay pretty soon. Massachusetts, well, they're trending up, and their case trend is up. Their test is at the average, and they have a very low positive rate. So they look pretty good, although the governor there decided to delay opening for 2 more weeks. Rhode Island, which is my home state, is a little bit more disappointing, only that recently its transmission rate is the second highest amongst Portuguese community states. Its testing has dropped from being the highest in the nation to being amongst the lowest, and their positive rate is going up. Fortunately, they're still not trending an upward trend, so we'll see what they plan on doing. New Jersey, quite good state. They're all green. I don't know why that turned yellow. So they have a low transmission rate, they have a good test rate, and they have a very low positive rate. Florida, where I am now, I don't understand how you can open schools. You have 17.8% of people who are testing positive when they get a test. The testing rate is below what it should be, and the number of children developing COVID-19 in Florida is increasing. It's 9% of the total population now here. New York, great state. Connecticut, great state. Hawaii, not good. So these data are available to you at these websites, and you can look at your state, and you can drill down to your local community, because what happens in a state is that's the whole state. What's really important is what's happening in your local community with regards to schools. So in the end, what I'd like to do is to close. There's not going to be a silver bullet. This isn't just going to go away. You're not going to have a vaccine and everything is fine. But it is going to go away, and things are going to get better. And we should be optimistic. And things are actually getting better. We need to be cautious. Think about not just today, but next month and next year. And we have to be confident that in our actions and that we follow rules that we believe will keep us safe. And if we do that, it's not that hard. Vaccines will probably start to come out to all of us sometime in the first to second quarter of next year if the phase 3 trials are good. But if a vaccine is 60 to 70% effective, that means 60 to 70% of people out of 100 are protected. Well, you don't know that. And so you're still going to need to have social restrictions in place, because you'll only know if you got sick. So I have a lot of optimism in antibody therapies. They're currently undergoing phase 3 trials. They should be available, results by September. And these antibody trials, antibody therapy with monoclonal antibodies, it's like using plasma, but it would stop the disease and you don't get sick. So the combination of having a vaccine and therapies is going to probably be what gets us over the hump. I actually went over. I wanted to stop, but I didn't. So I'm going to end my slideshow here and turn it over back to Angela.
Thank you so much, Dr. Amaral. That was a ton of information. We do have a couple of questions, but one thing that I did want to get to is something we talked about in preparation, our preparation discussion, which is, one thing that's weighing on the minds of the community is how do we move forward with our celebrations and our, we have so many clubs and organizations and festas that are, a big part of our lives, and those have really suffered. So given, all of the information that you presented here, what would you recommend in moving forward? And I'll just suggest that you stop sharing your screen because we see your desktop right now. But what do you suggest in terms of, everybody's really anxious to start having festas and dinners again, and do we do them all outside now, or, what would you suggest?
So when we talked about that, I left thinking, wow, that's the hardest question I've ever gotten. It's not a lot. There's not a lot that I can put to it with science. And I understand how important they are, right? They're tremendous fundraisers for the Portuguese community. They're tremendous social gatherings. I remember as a kid going to, Festa de São João and Nossa Senhora de Fátima and all the different feasts. They're an important element of continuing the culture of the community of Portugal in our children and our heritage. So it's not like there's a simple answer, throw them away. The problem with festas is they're social gatherings. And in most states, there is a limitation on the number of people that can congregate in one place. I don't know what it is in every individual state. I know in Rhode Island, it was 25. I think they just increased it to 15. If you're in Florida, they probably don't care how many people get together. But when crowds get together, the risk of spreading is greater. And again, you use masks, you use social distancing, all that helps. But part of a festa is actually the closeness of the people. And I get concerned that you say you're going to social distance, but you don't. I watch just, if I have a friend over, suddenly it's like, we're not 6 feet apart. So I can't in good conscience say, well, you can have a fest and you can socially distance, because I just don't think it's going to happen. And because there's so many super spreader events, I think it's a problem. Now, it's true, if they're outdoors, it'll probably be better. But I had a great experience, which I still haven't written about, but I plan to, which was I participated in a bar mitzvah. A friend of mine's son was having a bar mitzvah. It was all done through Zoom. It was amazing. There were like 220 people watching this event, and it went on. Musicians can play music. You can watch a folklorico. So you minimize the in-person contact. You can auction items. You can have amazing auctions using Zoom. So I would ask I guess my only answer is there is no answer. And so how can we use our own ingenuity to do what's important, which is maintain our heritage, continue to instill culture in our children, grandchildren, and raise money to support communities. And I think all those things can be done for the next 3 or 6 months without having to get people together. However, I don't have an answer to that question. I can tell you how the virus binds to the ACE2 receptor. I can tell you lots of stuff, but I can't answer. It's a very hard question.
Something that a lot of organizations have been doing out here in California are drive-through meal pickups. So selling bifanas, doing a sopas giveaway. Is that something that you feel okay with? Is that? And,
yeah,
and I will
that.
Mhm.
Yeah, I think that's a good idea. You have to. So you have to be. The only thing you have to be careful about there is, in general, something I didn't cover is, there is, to my knowledge, no well-confirmed case of spread of the disease from an article. We don't clean our groceries. We don't clean packages anymore. I did in the beginning. Basically the CDC has said it's not a very common route of transmission. So the risk you have if you hand something to them is that you're going to, carry that if they just coughed on it or breathed on it and left a lot of virus, there's, an outside chance that could happen. But I go back to the days of TB, and during TB, at one point, people were so paranoid that they told everyone, don't sweep your floors. Because when you sweep your floors, you get the bacteria in the air. You have to mop them. It turns out that wasn't true. So I think that's a highly low risk activity based on what evidence there is. I still would be very careful with it. They should be covered and wrapped, and that I would take the item, put it in my car, clean, and then clean it. So that there's just the idea of keeping your hands clean and soap, I think, is important there. I haven't done it, and I've got to be, transparent and say, I probably wouldn't feel comfortable doing it. It's just all these variables in my head. On the other hand, if you mailed them to me, I probably wouldn't care. So I think it's a little bit, I think it's a little bit of my own paranoia versus reality, but I think the right guideline would be, there is some risk in that transmission, so we should be careful. Like if I get a package, I open the package, I go wash my hands, then I take what's inside the package out.
There's actually a question here. It was a question I had as well, but I think someone just asked, and so we can maybe, as we say in Portuguese, kill two birds with one stone, or it's actually international. Huh? How can we improve the contact tracing? That's the question from someone in the audience, taking into account the fervor around the privacy issues in this country. And indeed, that because all of the countries, and your data showed that, all of the countries that have been using the contact tracing have been able to get these cases under control a little bit more than we have because of all the science that one has around that. Is there a happy medium? Is there a way to go forward with this? Because it's going to be important in controlling the virus.
Right. So I agree with the statement, and I think there's two elements to the question, and both of you and the person who asked it, right. I mean, there's definitely an element of privacy that comes into play here. But there's two types of contact tracing. So there's the contact tracing that comes from apps, or if you go to, I think it's Hong Kong, could be Singapore. Well, I think it's actually both. Like if you go there, they put a bracelet on your leg, or they put an app on your phone, and they know everybody you went in contact with. Because if you get sick, they're going to follow you. I have a hard time believing that's going to make it too far in the United States. But the truth is that when it comes to privacy, Europe is actually more restrictive in privacy laws than the United States. And many people might not appreciate that. I know that from healthcare. You can't even share patient data in research studies across countries. It's super, super restrictive. But they've been able to institute them. And I'll get to that in a second. So there's the apps. That's not going to work probably. And maybe that's why we don't use them in the United States. But the bigger problem is we simply don't have enough people to do this. And it's a self-fulfilling prophecy. If when you have 1,000 cases, you have enough contact tracers, you can stop the spread. When you have 4 million cases, there's so many contact tracers necessary, it almost becomes, it's impossible. I mean, most people would say that today there are so many cases, contact tracing is not really going to keep up. But in a school, you have a very defined base. And there is a need to have contact tracers. So fundamentally, this comes down to basically the role of the government. The government does have the right to override your privacy in the case of a public health emergency. And there are laws. They've recently been debated in the Supreme Court. And it's all right, because it doesn't mean you can have privacy erupted forever. And I think that's partly how they got it through in Europe. But what we need is more human bodies on the ground that are doing the contact tracing. It's an astute question because Japan was able to control until recently and still basically has the control. They did no testing. They did it all with contact tracing. They had a very effective system of nurses in community health centers that they deployed to follow every patient, and that's how they did it. We don't have that robust health system either. So we're depending on a depleted number of people with great, it's estimated that there's we need over 1 million people to do contact tracing in the United States. So I would at least like us to focus on making sure that the schools have it. And if big business is open, I also believe they should employ people to do contact tracing as part of the reopening, so that when they reopen, there's somebody responsible that works with the Department of Health. They should report it to the Department of Health, but they should also be involved in that because it's about the other employees in the building too.
There's
no simple answers.
Yeah, there's another question here, and we are coming up on our time. Why the higher rate among the young people in the 0 to 4 age group versus other young children?
Yeah, so in general, the data for the influenza is that they don't have any immunity. So there's a high actual death rate, which it doesn't show up there in children less than 1. Here, we don't know. What most people think is that children might be having less symptoms to start with and less infection rates because of the receptor that the virus binds to is in lower frequency in the nose, and we don't know the lung, and it increases with age. When you're confronted with a virus, there's 2 mechanisms that are at play. The first is what's called innate immunity. It's a rapid response. Think about it like sending missiles in. These are by T cells, and they have a memory also. Today, it's generally believed that up to 30% of the population has an immunity of some degree to SARS-CoV-2 based on prior exposures to the regular coronaviruses that float around giving us the cold. The second response we have is antibodies. Vaccines can trigger either the antibody response or the T cell response. To date, all vaccines are triggering both. So the general belief is that children, through their experiences with colds, get a T cell response so that they are going to be much lower. But children 1 to 4, you don't passively transfer from when you're born, you don't get T cell immunity from your mother. You do get antibodies, passive immunity, but you don't get the T cells. The T cells are yours. So they have no T cell response, and then the antibodies the mother didn't have, so they didn't get any of those. So those 2 together would increase their rate. But as children get a little bit older, they're always got colds. And so they probably have a high exposure to these coronaviruses. And in some cases, they end up perhaps with what's called cross immunity. That's also very common for influenza. That's why not everybody gets influenza when they're with somebody with influenza. You have some immunity from prior exposures. So that would be my explanation. It's that those young children do not have any T cell response because they haven't been exposed to anything. And they have no antibodies because nobody's been exposed to it. And that's why it's a little bit higher.
Denise, did you have any other questions? I think
No, I think
did we cap?
we're just about out of time. So
Yeah. Well, I will just say that your the information you presented was very comprehensive, and I personally actually have a little bit more optimism and hope, because as you were saying in your slide, everybody kind of feels like it's the apocalypse and oh my God, we're never going to get back to normal. We're going to be, social distancing for the next, 20 years, that kind of thing. And so seeing, the data compared to other pandemics and how the world has evolved, it puts it in context. And while we will have to deal with this for, maybe a couple of years even, there's a light at the end of the tunnel, if you will.
So to your point, Angela, no matter how we look at this in comparison to the 1918 influenza, the fact is 675,000 people died. I mean, it was horrible, right? There's a story that depending on your age, when somebody died from influenza, they would hang crepe. That's actually the concept of hanging crepe on your window to say that somebody had died in that house. And they would use different colors for age of the person that died. And in a story written about it, the kids would go out and they'd be looking at the different colors, and every house would have crepe. It was horrible. Yet, when it went away, and everybody started. Now, this is different than influenza, because influenza, this isn't acting the way an influenza normally acts. And I think, as I said, it's endemic, and we still need to understand better. But on the other hand, it is remarkable. I mean, we need to just remember, it's only been 6 months. I know I could say, oh my God, it's been 6 months, but it's only been 6 months. Each day we learn more, we get better at it, we understand it better. And right now, cases are going down everywhere in the United States. The use of masks, social distancing, and all those things, they actually work. Texas, Florida, my God, we have 15,000 cases a day 2 weeks ago. They're down, I don't know, yesterday they were 8,000. California, dramatic decrease. Arizona, dramatic decrease. Using masks, socially distancing, they're not that hard. And one final thing, for those of you that have grandchildren, there are ways to do this. So if you want to see your grandchildren, you can actually get a COVID test. And so can they. And you can all be safe. And I actually wrote a whole essay around how to do that. Mm-hmm. But if your grandchildren are coming over, plan on keeping them for like 2 weeks and enjoying the time, because you don't want to go through all that effort for one day. Mm. But once they're there and with you, they're part of your bubble. So you can test yourself. I would do 2 tests separated by 3 days apart, and they're both negative. Get together and then stay together for a while. Have a vacation.
We did get one last question. Now that we cannot have the usual festas, should our various social clubs take a more crucial role in education around this pandemic? So that's actually a great idea. So the clubs educating their members on what's going on.
Yeah, I first of all, I think that's a great idea. It should be. It's funny. Basic things. I mean, I made spaces up, but I mean, just basic 3 or 4 things, telling people what to do, educating. Mm-hmm. I think that's really important. Advocating. Stay out of politics. It's really just about us being able to do better. I think that's a great idea. And I still think there are things social clubs can do. 4 musicians can get outside and play, sure. As long as they're separate from each other. And I'm sure all of you have seen on television bands playing where each person is actually in a different house. Mm-hmm. And it sounds like they're all together. So I see that as a problem even with schools. I sit there and I get upset because I think everybody has just decided we're going to open up schools, and we wasted 4 months trying to figure out what are other ways that we can educate our children. What are other ways that we can get them food? What are other ways that we can get their mental health problems resolved in a short period of time? It's not like they're never going to go to school again. And so I would encourage everybody to use their creativity. You'll come up with great things, and just be sure to be able to support the culture. And you can have reading clubs. You can Portuguese stories. It's all sorts of things. I'm not completely aware of the things that normally happen, but I remember as a kid going to all of those things. And as a kid, I was usually bored sitting there with my parents at the festive.
We all were.
But it made me proud to be Portuguese in the end. And that's ultimately remembering culture and history is important. So I endorse it.
I do just have one very quick question, because lately here, especially where I live in Central California, there's been a very dramatic increase of healthcare professionals getting COVID, and actually a few doctors. A very prominent and very loved local doctor just passed away yesterday, which hit our community really hard. And a Hispanic doctor who had a very close tie to the Portuguese American community. And how does the medical profession look at this, and doctors, nurses, EMTs, etc., because they've been especially hit hard in a lot of ways. They're in the front lines, as we all know. Other people are as well. But how does one in a medical field go to work every day with this on their mind?
Yeah. So fortunately, I don't know if I say fortunately or unfortunately. The reality is I can only speak from prior experiences. I can't speak of this because I haven't taken care of patients with COVID. I actually thought of it and realized 65, probably not a good idea. The first is that healthcare professionals do die as a percentage much greater than others, than other populations. I don't know if it's greater than the Black or Latino community. I haven't looked at the statistics. And I can tell you that the rate of infection is higher in healthcare professionals wearing wearing personal protective equipment than it is in the standard population. So being constantly exposed to this does increase your risk. Now, that doesn't mean the equipment doesn't work. Excuse me. If you wear this all the time, you break the protocol. You don't even realize it. So I think that to answer your question fairly, I have to look at it and say it's a 90, I'm going to guess, it's a 90-10 answer. 10%. So for anybody who's a physician, I think about dealing with HIV. You just go to work. That's what you got paid. That's what you trained to do. That's what you got paid for. You don't give it a lot of thought. Doesn't make you necessarily feel good. And as a surgeon, gosh, I get stuck with a needle probably once every other day. Didn't make me feel really good. Just got a lot of blood tests. So I don't think that healthcare professionals worry about themselves getting sick. Healthcare professionals do worry about getting sick and bringing it home to their families. And that's probably the biggest issue on their minds. And I know in my case, there were places that I worked, I would actually take my clothes off outside before I came in. I was so disgusted by where I had been. And so I can only imagine that that's the foremost concern. The 90-10 rule. So why did I say that? Because there are 10% of physicians who I read and what they say. Frankly, I wonder whether I don't understand their point of view. And so I can't really speak for them. But for 90% of doctors, I think that besides their concern of their family and nurses, and generally what I hear is that they just feel a tremendous sense of frustration that they're working so hard to do all this and that everyone around them isn't working hard to try to stop it. And that is probably the biggest message that, that's why we all need to do this. It might be uncomfortable. It might be whatever. You might believe that, there's people on Mars. It doesn't matter. fact is, more people are getting sick, more people are getting hospitalized, more people are dying, and more doctors and nurses are being exposed, probably unnecessarily. So that is a very common sentiment that I read, that I hear, and that's kind of a slap in the face when you're doing, on top of everything. Imagine if you're fighting imagine you're a Vietnam vet, that you're fighting a war that you don't even really want to fight, and everybody at home is complaining about the war that you're fighting. You don't feel very good about it. And now we have, those people, we owe them a great debt of service. And yet here we are 20 years later, and we'll never be able to make up for the torture we created for them. So it's a little bit of that.
Great.
It's a good analogy. So I think we are going to wrap it up, but this has been awesome.
Yeah.
We may have to have you back as things progress and we have more questions. And
my pleasure.
This
and
is
there are
recorded.
there are other topics. There's, I tried to limit it to certain things. Antibodies we talked about, in more detail on schools. So yeah, I'm happy to do that. It's good because I have to reorganize my thoughts, makes me read what I wrote. It's good.
And and the data is changing every day. So in
Right.
2 months or so, things could change a little bit, and we can, again, to that gentleman's point about educating the community.
Yeah, I think it's wonderful. Just like right now, the schools would be a great topic for parents to understand. It's not that you should open or shouldn't open. It's just not a black and white answer. But people being knowledgeable and not just listening to what everybody, people argue ideologic points of view. There's a lot of information in the middle. So anyways, that's what I try to do, is to filter it. I think the more educated, the more aware we are of all the issues, the better off we will be. And not just listen and say, oh, well, Jack said this, so that's what it must be. Spend some time, read, understand, and be able to ask questions and be given direction. I think it's a great idea, the idea of more public education.
Great.
Well, thank you so much.
We will certainly have you back.
Thank you.
And
Appreciate it.
everybody out there, thank you for joining us, whether you were on Zoom or whether you were with us on Facebook Live. This is going to be recorded, so you can always watch it again on Facebook or on YouTube. It will be on YouTube in a couple of weeks. And until next time, have a great evening, everybody.
Thank you so much. Thank you,
Thanks
Dr.
so
Amaral.
much.
Abraços.
Alrighty.
Thank you. Thank you.
Abraços. Tchau.
Abraços, abraços. Adeus.
Tchau.
Tchau,
Bye-bye.
tchau.